What's going on, Coach? My name is Noah Fernandez, and my presentation is on ACLs and their surgery and how you can tear them. So, what is an ACL? An ACL is the tissue that connects the thigh bone to the shin. It's right in the center of the knee, right underneath the femur, and it connects straight to the tibia. So, what it does is that it stabilizes the knee joint from giving out, because without it, your knee would shift all the way to one side or shift all the way to the other side. So this acts as a stabilizer, and it's almost like a metal rod that's in the middle of your knee. Obviously, it's not an actual metal rod, but it stabilizes the knee so that you can plant and you can like jump off, or like in sports, you can cut in football, or you can jump or do all the physical activities that you need to perform in sports. So that's what it does. How can you tear it? It's mainly caused by a sudden twisting movement at the knee. So in most cases, personal case for my sister, she had torn her ACL at a basketball game. And so she went up for a layup, and the defender bumped into her, causing my sister from going up towards the board, her whole body twisted towards the mat at the end of the court while her foot was still facing forward. So in that case, it was a sudden twisting movement because it was unexpected, and it was a forced movement that she would not have made if she had not gotten pushed. So, and how does it, another thing is, how does it affect you? It's caused by, the knee will start to swell, and it's almost like a popping sensation. A lot of people say that they either hear a pop or feel a pop, and this can cause you to hurt. It will hurt your knee while you walk or you run, and if it is left untreated, it could lead to be a chronic issue, causing you difficulty walking in the future if you don't get the surgery. I will talk about this later, but the surgery is pretty crucial. Most surgeons and most doctors will recommend and strongly encourage you to get the surgery, whether you have the money or you don't, because if you don't, then you will probably have to rely on crutches or a cane or something that will help you to walk, because you'll be really affected by this injury, especially if you're trying to get back into sports. If you're trying to get back into sports, then you will want to get the surgery. So the types of tears, there are 3 types: grade 1, 2, and 3. The grade 1 is the injury stretched at your ACL. Stretch your ACL out enough to damage it, but it's still in one piece. So it's not so much a tear, but it's a stretched out ligament. Grade 2 is that your injury stretched out your ACL so much that it's either loosened or torn, partially torn, meaning that it's not as bad. My sister's was a grade 3, which is a complete tear, and your ACL is in 2 pieces. So that was pretty difficult. I remember I was, I think, 12 at the time, and I had to carry my sister out of the game because she couldn't even walk. That's how bad it was. And so yeah, that the grade 3 is the most destructive, I guess you could say, because it's directly in 2 pieces. And if you had a grade 1 or 2, you could probably hobble off. It would still hurt to walk, but a grade 3, it's really difficult to walk because you've lost the stability in your knee. So how does the healing process work? The healing process starts with surgery, and you'll be able to recover in 6 to 9 months, depending on how you feel. Usually it takes over to 9 to, I've heard people go into 11, 10 months, just depending on how your body works and how fit of an athlete you are and how your body reacts to the surgery. The surgery will have you out for around a month. I remember my sister had came back from surgery, and she did nothing for around a week. And a month, and week 2, she started walking around a little bit, not very far. We don't have a really big house, and it was hard for her to walk to her room, which is on the other side of the living room, which is where she would spend most of her time. But usually 6 to 9 months, 6 if it's fast. Then afterwards, they will give you a brace that will stabilize the knee, and they'll recommend anytime that you do anything physical or anytime you're either playing your sport that you tore your ACL in or you're doing anything recreational or active, they'll want you to wear the brace. and you'll see most linemen wearing it in football games. Even if they have not torn their ACL, it's always a good thing because you want to prevent that injury from going further into or you just want to prevent the injury in general. You know, it's kind of covering your bases before anything else happens. So how does the surgery actually work? This I found was interesting because I see like this picture and like I'm not queasy when it comes to like blood, but like you can see like right here the instrument is in her knee and they're like moving it around, and so like they'll move the knee around and it looks freaky, but they will reconstruct the knee at the tears, and so they'll put in these two. So this is a camera, this is the like, it has a little like grab at the end, and then all this is just like supplying the liquids needed. But so the surgeon will remove the damaged ligament and replace it with a new one called a graft, which is really interesting because it can be used from the patient's own kneecap or the hamstrings, or in that if it's too damaged, they will take it from a deceased donor. So I thought that was kind of interesting that they could like take it from a person who has passed away and give somebody else a new knee. So what is needed for the procedure? It's a combination of fiber optics, really small incisions like I told you, the little kind of gun thing that they have, the little drill looking thing, and then here's the camera, like I said. So this is called an arthroscope instrument, and then the cannula, and then it's the arthroscope, camera, and light source. So that little drill bit was the camera, and then you can see right here is the arthroscope instrument, and then right here is the kind of stabilizing part of the entire surgery. So the cost and the aftermath of the surgery. So usually ACLs, if you pay in cash, they come around 15,000 to anywhere from 15 to like 20,000, but most other available prices are between 20 and 30,000. So it's not a cheap surgery. It's very expensive. Most of your insurance, if you have really good health insurance, I know my mom did, it took care of it, and we ended up having to pay around like 5,000. I think that was left of it. But yeah, it was just a huge ordeal for me and my family. Usually ACL surgeries, they are extremely painful, not during, obviously, because you're gonna be knocked out, but you will, afterwards, I remember my sister's knee was all bruised up and it looked like she had just like tore it again, but it was like excruciatingly painful, at least from what my sister had told me, and it was just like out, like she took some melatonin and went to sleep, and just because of how bad it was, like she couldn't stay awake for it. It was just so painful. But usually, yeah, like I said, it takes them about a week to get back to normal, just because it's a pretty invasive surgery because they're going into your knee, and the scars are really, really huge. They usually have it on the top of the femur, on the side of the knee, and on the left side of the knee as well. So right and left, and a little bit of the quad. And so my sister still has the scars, but it's just a huge surgery. What I found interesting about this year, I really liked the House and Bones episodes because they were intriguing and educating, and also they were entertaining, just because of the drama and all of that. So I thought it was really cool. What could I have done better on this presentation? I feel like I could have put a little bit more info, maybe a video or two. I wanted to get my sister's video of her tearing her ACL and then maybe a picture of her scars, but I just couldn't upload it to my computer. And then obviously I could have done a little less stuttering. Here's my bibliography. Thank you, Coach.